Hi, I'm recording my son again. We're doing an abdominal assessment, a physical assessment. We're also going to be assessing his kidney function, and we're also going to be discussing a testicular self-exam. So I would ask you first, did you use the restroom before we start the physical? Okay, good. Go ahead and lay back for me. And I would start by auscultating his abdomen, and I would listen over the aorta, certainly listening for any kind of loud sounds that would indicate a AAA. And then I would start assessing his upper right quadrant, his left upper quadrant, his right lower quadrant where his appendix is, and where his descending colon is. So you have the ascending, transverse, and descending colon, and all of his bowel sounds sound normal. They're not hyper or hypoactive. I would then palpate and feel underneath. Take a deep breath for me and blow it out. And I would just press lightly, and I'm able to palpate where his liver is. He's a little ticklish. And then I would just do with one hand and make sure there's no umbilical hernias or anything like that. Nothing down in this area that's sensitive. Okay, and then I would test for rebound tenderness. I'm just going to press lightly. When I let go, let me know if it hurts. Does that hurt at all? No? And I am assessing him and making sure that he's not having any guarding or any sort of pain, any grimacing. I would then assess at the mid-clavicular line where the liver is, and then I would do the Renaissance tapping and see where the dullness starts. It starts right a little bit above the chest, and then I would keep going until I heard the light tapping again. So it's about, I would say, let me measure it. I would say it's about 8 centimeters long, so that's completely normal. You don't have any enlargement in your liver, which would be an indication of hepatitis or things of that nature. And you do not drink any alcohol?
No, I do not drink.
Okay. And then I would feel over here where the spleen is, and there's no enlargement of the spleen, certainly if you have mono or anything like that. Okay, and then I'll have you sit up for me, please, and face this wall. And I would go to the 10th rib. So, and I would check for any pain or any flank pain. Are you having any pain in this area?
No.
Or any pain in this area?
No.
And when you go to the bathroom, do you have any burning or anything like that? Any frequency? Do you feel like when you go, you're able to completely eliminate your urine?
Yes.
Okay. So his urinary system seems fine. His GI system seems fine. His liver and his spleen seem normal, and there's no tenderness. We already discussed his history, and I documented those things. I would then teach his testicular self-exam, and then I would explain to him, just look at me for a second, that what you would do is you're in the shower. Every month it's important. You would hold your testicles with your hands, with your fingers on top and your thumbs on the bottom. You basically rub over your scrotum. You'll feel a cord that's called a spermatic cord, where sperm basically comes out, and it's rope-like, and that's completely normal. As far as having any lumps or hardness or pain, that is something that could be an indication of testicular cancer, and you would need to report that immediately to me, and we could get you to a physician right away. Of course, if I wasn't available, you would just go for your regular self-exams.
Gotcha.
We've also discussed having STDs and the importance of any type of diseases, STD, sexually transmitted diseases. AIDS is on the rise again, and that's something that could be deadly. It's important if you're having any kind of sex, which I know you're not, that you need to have protection, and some things you can't even get protection from. So having the importance of making sure that you're sexually safe. Do you have any questions?
No.
Okay, thank you.
No problem.
Thanks again for watching our video.